Construction is the number one industry for deaths by suicide. And as contractors, we spend so much time and efforts focusing on safety within our industry. And yet when you look at deaths by the Focus 4 topics from OSHA, there's 5 times as many deaths each year by suicide than there are by any of those workplace-related fatalities.
Since the suicide issue became an issue and we became aware of it and we started down this road with the Alliance, the important thing has been trying to grow that awareness to include mental wellness as well as physical wellness so that we make sure that people get back home safely into our work sites, mentally prepared to do the work. And it's all about their health, and you need to consider physical health and mental health at the same time. You really can't separate the two, and that's what I think the Alliance and the suicide prevention movement can do if we keep that energy going forward.
Construction is a unique industry because of the safety measures that we already have in place. So the great thing is that it's easy to kind of bake in some suicide prevention efforts, and it really comes down to culture. And so in an era where we're so focused on workplace development and attracting and retaining employees, paying attention to culture is really important regardless. And that really is what integrating suicide prevention and mental health in the workplace comes down to, is really focusing on that culture, that caring culture where people feel supported, they feel cared about, and they feel safe to ask for help if they need it.
I think CFMA is an ideal catalyst, partly because of the broad network and leadership that we have nationwide with so many chapters that we have. I think we're at 98 now. So I think CFMs have a great role to be able to start being the change agent for this. And once the change agent gets moving and gets the rest of their company on board, then we can go and do a lot of things with this initiative with safety, HR, company owners, and make the thing really positive and a good impact on our employees.
CFMs are in a great position to tackle this issue because they often oversee HR. So they have a direct influence on HR, and yet they still work closely with the executive level so they can get the leadership buy-in that's required for any type of cultural change. In addition, they do impact safety. And so they're kind of that integral wheel in the cog that can really reach a lot of people and get them involved. At the same time, we recognize that each company is different, and different people getting plugged in different roles is really important. So that's the great thing about getting this out industry-wide, is that we can reach those other professionals and other roles to make sure this is permeating at an entire organizational level and support the CFMs that are working to get this integrated. On preventconstructionsuicide.com, we have a wide variety of resources for contractors that are wanting to integrate this into the workplace. So a great place to start is with our needs analysis and checklist. It takes contractors through a lot of questions about things they may or may not be doing in their workplace and gives some ideas of about how to integrate this at different levels, from a leadership level to an HR level to a safety level. And so it gives different ways in different parts of the organization to integrate it. There's also some great resources to read more and understand why this is an industry imperative. There's a couple of great PDFs of 10 questions that leaders must ask themselves and 10 action steps that they can take that are full of information. We just released some new documents of 3 levels of suicide prevention integration. So it's kind of a simplified version of the needs analysis and integration checklist that people can take kind of bite-sized steps into integration. As well, we have tools that employees can directly use, like a mental health screening that was just launched. That's a great way to build awareness and help people identify things that they may not even recognize in themselves need some attention.
I would just say it's really important for people to realize that our people are out there. It's an issue that's been shoved under the rug, and the stigma associated with it has really been a problem forever. And so it's time to start the dialogue, start the conversations going so that people get comfortable with it. Until they're comfortable with talking about mental wellness, suicide prevention, it'll never go anywhere. So you have to start the discussion, get people comfortable in the company of actually talking about it, no different than they talk about physical issues that they need to protect their employees for on the job sites. And then I think we'll make great progress in getting that services and those resources out to our people.